Tim Weyant, clinical specialist, talking today's video about the top 5 breast implant complications. Check it out. Hey everybody, Tim Weyant, clinical specialist here with the Aspen After Surgery Center, talking about today the top 5 breast implant complications that a patient may experience having a augmentation, whether it's cosmetic or reconstructive. So we in general kind of have videos specific to the treatment that we do here at the Aspen After Surgery Center. If you're new to our channel or if this is your first video, we are a specialty center for the non-surgical treatment of breast implants, liposuction, tummy tuck, facelift, and non-surgical solutions for issues after surgery. But what I wanted to do today was shoot a video on generalities specific to breast augmentation, some things to pay attention to, some things to be aware of, or just general information that you can use regarding if you're choosing to have a breast augmentation or if you've already had a breast augmentation, okay? So the number one reason why patients would essentially have an issue or may choose to revise surgery is because the size, the shape, the position of the breast implant. So there's a couple of phenomena that can occur after having a breast augmentation. Number one is patient just isn't happy with the size or the shape or the way it looks. This can be from many reasons. It could be the size of the implant, it could be the placement of the implant, it could be the type of implant that it is, or there may have been changes in the body that occurred after the implant went in. Common issues we also see regarding shape and size is age of the implant or things that the patient may have gone through since getting the implant, one of those being pregnancy or breastfeeding. So if you have implants and you choose to get pregnant or breastfeed, or if you had implants in for a while, and this is something that you may be thinking about in the future, one of the things that can happen after a breast augmentation once you become pregnant and breastfeeding is drooping or sagging. So those nice, perky, round breast implants that you've had for a while that look great and you're really happy with them, over time can begin to sag and droop. And that'll change the look of the breast. It'll change the look of how the overall structure of the body looks. And essentially what happens is what may have been a once high or firm or perkier look to the breast will begin to sag and lower. One of the best ways to see if there's changes that occur after a breast augmentation is to kind of use your nipple as a reference. So I'm going to use my implant model here. I guess we could say the ideal look of a breast is when the implant is sitting directly behind the nipple. And the nipple is a telltale sign, assuming no radical reconstruction, in which if the implant and the nipple is directly pointing out in front, everything's okay. Probably like the way it looks. But over time, breast implants may begin to droop or sag and cause the nipple to look upwards. That again, pregnancy and breastfeeding being the number one cause of that dragging or sagging, okay? The other issue that some patients may experience is if the implant goes the other direction. So if the implant rides up over time and the nipple starts to look down, that could be from a condition called capsular contraction. We're going to talk about that more later in the video. Other reasons and things that we may see regarding complications or issues that occur after plastic surgery. Number 2 is breast implant rupture. Breast implant rupture can occur in surgery. It can occur after surgery. There's a number of reasons why a breast implant may rupture. It could be the actual valve, the material of the implant, trauma to the implant, or even capsular contracture, which is a condition that squeezes the implant and may actually degrade the implant over time. So how do you know if you have a breast implant rupture? Well, considering the two basic types of implants are either saline or silicone, the easiest way to identify that if a rupture has occurred is by how quickly a change has occurred and what you have seen. So if your implant is saline, a rupture is kind of like a flat tire. It typically takes place very quickly. And you'll just know that basically the integrity of the breast and the volume will begin to shrink because essentially the saline fluid is now leaking out of the breast implant and you get a sort of deflation or the size of the implant. If your implant is silicone, with today's gels being cohesive, it means it's almost like a gel that cracks and fractures. It doesn't really leak like a fluid, it really breaks. Some people use the description of gummy bear. So if you imagine a gummy bear and you kind of stomped on it, it doesn't really break, it just sort of mashes and flattens and moves apart. Signs and symptoms of a silicone rupture will be more sort of long-term. It takes a little while to notice this, and those are typically soreness, redness, irritation, maybe even some rashes or discoloration to the skin, and that's how you know potentially you have a silicone-based rupture. So that is the number 2 complication that typically patients will seek out surgical revision to try and correct from a complication after a breast augmentation. Other issues that we see is rippling. So number 3 complication after a breast augmentation is rippling. So what is rippling? Rippling is typically where the implant is visible on the side of the patient's breast due to the fact that the implant most likely is saline and the patient does not have a lot of fatty tissue. It's real thin layer of skin, not a lot of fat. It's typically noticeable from the side, or if the patient is face down and the implant is hanging, you will see that rippling on the lateral side of the breast. So that is the number 3 complication that could potentially lead to a patient looking for further surgery to try and correct that issue. Okay. Number 4. Capsular contracture. Capsular contracture being more common than we think or that we see based on data and studies and literature that tout anywhere between a 3% or 5% is actually more common than most people know. What is capsular contracture? Well, capsular contracture is where the normally occurring shell that grows around the implant begins to thicken and harden over time. So imagine the breast implant went in right after surgery, your body forms this pink shell around it. This pink shell is called the capsule. Well, that capsule grows around the breast implant, and in a soft, normally shaped, normally positioned breast implant is going to be squishy and soft and look normal. It's going to be right on the chest wall where you want it to be, typically located right behind the nipple, and it feels good, it looks good, you can hug people, people can squeeze you, there's no pain, and everything is good. But what happens when capsular contracture sets in? Well, this shell begins to squeeze and harden around the breast implant, and what patients will notice is that that breast implant is going to start to ride up. Now, typically it's only one breast that does this, but sometimes you can have both breasts doing it. So if both of your breasts are very high, firm, and perky, or one of them is higher, which is when it's more noticeable when they're lopsided, you may have breast implant capsular contracture. So what do you do about capsular contracture? Well, here at the Aspen Center, we offer a non-surgical technology and a treatment that can treat capsular contracture in order to avoid surgery. In some cases, you may be too advanced or the implant is older, the implant is ruptured, which you remember from early in the video can be one of the signs of an implant rupture is getting capsular contracture, and in those indications, surgery is absolutely indicated for that. It is very important to juggle non-surgical options versus surgical options because unfortunately, surgeons, despite their best efforts when going in for surgery, removing the implant and removing the capsule, can still potentially lead to a very high reoccurrence rate. And depending on whose data and literature you read, if you go in for capsular contracture surgery revision, stats are as low as 50% up to 90% that you're going to re-encapsulate again despite a surgeon's best efforts. Okay, number 5. Probably what has gotten a lot of press lately regarding a complication in plastic surgery is called BII. BII is breast implant illness. Now, this condition or this diagnosis is fairly obscure because the medical community doesn't really have a consensus on why it happens, if it's even happening, tests to confirm that it's happening. But what we do know is the following. If you have had a breast augmentation, regardless of the type of implant, and you start to notice the following symptoms of fatigue that's unexplained, brain fogginess, forgetfulness, joint pain, aches and pains that are unexplainable all over your body, redness, rashes, and there's a whole host of other symptoms which I would encourage everybody to look up and Google to see if you have this. It could be a result of the toxicity of the breast implant, the material of the breast implant leaking or coming out, and this can lead to further problems. So our number 5, again, breast implant illness is one of the top 5 complications that patients would choose to remove their implants completely. So if you guys have any questions, you're experiencing any of these symptoms or any of these issues of the top 5 complications that I've just mentioned, hit us up in the comments below. Let us know, hey Tim, I've got this, or I'm experiencing this. What are my options? What is it that I can do? Any other clinical questions that may be something more that we can look into and diagnose, especially if you're suffering from breast implant capsular contracture. We do offer virtual evaluations from anywhere in the world where we can talk to you about these complications. We can talk to you about these problems. If indeed we are the source or solution for that, we can help you on the right track. Bear in mind, we are all clinical specialists and licensed physical therapists here. We are not surgeons or doctors, so we can't really give too much commentary on doing surgery or surgeon based type of information, but we can certainly lead you in the right direction. So thanks again everybody for watching our video, and we'll catch you on the next one.